Okay, so now we're going to talk about the pathogenetic factors, and this is pretty much the constituents of the bacteria of Staphylococcus aureus that creates the problems in human beings if it is absorbed through a mucous membrane or whatever. So the first thing we're going to look at is the alpha toxin. The alpha toxin creates pores in the cell membranes by lysing and entering the membranes, and pretty much its function is to cause cell death. So that's what leads to some of the skin reactions that you see. Along with it, even worse actually, is exfoliatin. This is a protein that disrupts the epidermal constituent conjunction. So pretty much what holds the epidermis together, it disrupts it. And it causes some of the stuff that you see like in scalded skin syndrome. And I'll show you a picture and you'll understand better what I mean by what exfoliatin does. Then you have pyrogenic toxin superantigens, and this one's really horrible because it causes major release of cytokines. And normally the release of cytokines is normal because that's what is released when you have an immune reaction to an antigen like Staph aureus coming into the body. But the problem is that it causes a lot of release of cytokines, which is also called cytokine storm, and it can lead to things like organ failure and major complications. So it's a very, very awful thing if it does get released, if it's in the body long enough. Another thing is enterotoxins, and these affect neural receptors, which lead to vomiting by the brain response. So if this toxin is released into the area where there are neural receptors, it could affect that and cause vomiting. There's also toxic shock syndrome toxin, and as the name suggests, it causes toxic shock syndrome, which has been correlated with tampon use from a long time ago. It's even seen now, but not as prevalent as it was before. And it's pretty much a similar mechanics as the super antigens in terms of the way it reacts in the body. So just like the super antigens, it can cause a lot of major problems like organ failure and even death. So that's why it was a problem when they had this issue with the tampons. Okay, so once the Staph aureus bypasses the external defenses, this is pretty much where the disease starts, pretty much. So there's a portion of it called protein A, and it binds to the Fc portion of its IgG, which is an immune cell, like it shows over here. And it prevents, by doing that, it prevents it from being ingested by phagocytes. So what a phagocyte does is normally it'll ingest a bacteria, and it'll show a part of the bacteria. So when an immune cell attaches to it, it'll know what it's looking for. And it's about as simple as I can make it for you. And also, as we were discussing earlier, its coagulase properties also slow phagocyte progression. So not only is it preventing its ability to eat it, to swallow it, and show its constituents, it's also slowed because of the coagulase properties that Staph aureus has. And even bacterium that has been phagocytosed can prevent being lysed by the phagocyte, and that's very important because it needs to break it apart to show the immune cells what it's looking for to destroy the Staph aureus. So pretty much the longer the bacteria spreads, the longer that it's not destroyed by your immune system, the better its chances of causing a local reaction. And the stuff that we were looking at earlier, the pathogenetic factors, the easier it is for the bacteria to release its toxins and cause even worse problems. So right now I'm going to show you some disgusting pictures. One of the problems, clinical presentations with Staph aureus, the first thing is called a furuncle. It's also known as a boil, and this is pretty much what it looks like. You can see the redness right around it. Pretty much is a superficial skin infection, and it usually resolves on its own. But this is pretty much what it looked like, and you can see the pus over here. So if you were to aspirate the pus and you were to put it on media or whatever, you would find that it's full of Staph aureus. And this pretty much occurs in sweat and sebaceous glands that you learned about in Bio 101, and hair follicles. Another one is impetigo, and let me show you a picture of this one. So impetigo, and this is an animation obviously, They're large blisters, and again, they're infected with Staph aureus. So if you were to take out the contents of the blister, it would pretty much contain Staph aureus. And again, it's typically found on the superficial skin. Another part is in clinical presentations is in deep lesions. So if the Staph aureus bacteria reaches the blood, God forbid, it has the potential of spreading to any other organ and tissue, which is, when it spreads to the blood, it's called bacteremia because it's in the blood. So bacteremia usually calls for emergent medical attention, because if it spreads to other organs, it can cause problems around the organs. I mean, obviously. And there were studies that showed that most cases of acute osteomyelitis, which is inflammation of the bone in children, is related to Staph aureus. So it's very important that once it's discovered that it's in the blood, that it's taken care of, that the child or adult is given antibiotic, and that it's taken care of. In this case, for children in acute osteomyelitis, it's typically found in highly vascularized bones. That's because their bones are still developing and it's still vascularized. So, as it gets going through the blood, it finds it easier to get there. Another clinical presentation, this one's a fairly disgusting one, is called scalded skin syndrome. And as you can see in the picture, it looks like this person's skin is peeling off. So, like we were talking about, that exfoliatin protein that it has, it pretty much causes the shedding of the skin, which is not good because it exposes it to the other layers, and it can cause even deeper infection. So it's most commonly found in children age 5 and younger, but it can occur in adults that are immunocompromised, meaning their immune system is not working as it should. And it leads to desquamation, which is pretty much just what this is, you losing the top layer of your skin, and erythema, which is just the redness that comes along with it. And I know this is black and white, but if you saw it, you would see the redness of the skin. And it normally occurs in the face or by the groin, but it has potential to spread to any part of the body, which is very dangerous, especially to sensitive areas of the body.